said what I was going to say, which is not surprising, of course. It was actually less than 2 weeks when I had my first meeting with Terry. And up until that time, I honestly had not thought very much about the power of patient advocacy and the important role that they play. You know, today when you have ice bucket challenges, it's on everybody's mind, but Terry's been doing this stuff for a long time. And it goes way beyond simply asking about something that they care about because of personal involvement. It allows you, as an investigator, as a scientist, to get a much deeper and more intimate understanding of what the patient deals with. And that's absolutely invaluable. And actually learning that lesson from Terry was one of the most important lessons that I learned very, very early in my tenure as director of NBCR. So as I look around this room, it's nice to see some familiar faces, but more importantly, I see many faces that are new to me. And that's wonderful news, because this complex set of conditions that have interrelationships that are yet to be unraveled requires, it's a team sport. And it just can't be one discipline or another discipline. It really needs to be an interdisciplinary approach. I think all of you appreciate that nature only has so many tricks up her sleeve. And so what you learn about one disease or condition that's related, you inform the others. And this is a strategy since the mid-2000s that the collective group has embarked on, and I think with great value added. The advances that we see, regardless of the disease or condition, regardless of the field of science, the advances all come at the interface of traditional disciplines, not being a biochemist or not being a neuroscientist. It's what happens at the interfaces. That's where all the action is. And so it's wonderful that this meeting continues to catalyze new assortments of expertise to bring their expertise to bear on this. As I had mentioned to both Terry and Alan, I have to sort of parachute in and parachute out today. But it remains something that I'm intensely interested in, that I follow very closely. Dr. Summerman and I get together, we do talk about this, among other things, on a regular basis. And I'm struck, if you just look at the titles of the 7 meetings, the 6 meetings that preceded this one and this meeting, you really do get a sense of the evolution, pretty rapid evolution, I'm going to say, and how this field is maturing and how this field is opening up new areas of inquiry. So Aqua was a good start, Aqua 2 perhaps even better, more to come. But I do want to thank the investigators, of course, for being here, but I especially want to thank the patients and the advocates who accompany them, because your voices are so crucial to this process. I do hope that the meeting is as fruitful as the program suggests it will be, and look forward to getting sort of the download from my NIH colleagues who are scattered throughout the audience and will be, I know, participating throughout the meeting. So thank you all very much, and I look forward to hearing what you all come up with this time.